Hello, today we are going to talk about colorectal cancer screening. In asymptomatic adult, the starting age for screening is 60 to 74 years old. The screening can be done by flexible sigmoidoscopy or colonoscopy, and the interval in this case will be 10 years. While if we use the fecal occult blood test or fecal immunochemical test, then the interval will be 2 years. So we have 10 years for sigmoidoscopy or colonoscopy and 2 years for fecal occult blood test or fecal immunochemical test. Now let's discuss the approach. If a man or a woman who is asymptomatic is having a positive family history, then we are going to do the screening regardless of the age. But we need to know the type of the lesion that is the family history is showing, and we need to know the number of relatives with family history of cancer, and we need to know the degree of relativeness. For example, if the patient is having a family history of hereditary non-polyposis colorectal cancer or familial adenomatous polyposis, then we need to do genetic counseling and special screening. In case of hereditary non-polyposis colorectal cancer, the colonoscopy is going to be done every 1 or 2 years. And here also the age of starting of the screening will be earlier. It is going to begin at the age of 20. And also sometimes we need to start it earlier than the age of 20. For example, if the father of the participants or the patient is having non-hereditary colorectal cancer, hereditary non-polyposis colorectal cancer in the age of 25, then the patient or the son is going to undergo screening 10 years earlier. That means he will start the screening at the age of 15. In cases of familial adenomatous polyposis, then we are going to start the screening earlier at the age of 10 or 12. And here the sigmoidoscopy is going to be done annually. Also, in cases of attenuated adenomatous polyposis, the colonoscopy is going to be done annually, but the age of starting the screening is going to be at 16 or 18 years old. Cases of familial adenomatous polyposis are having 100 or more than 100 polyps in their colon, while those with attenuated adenomatous polyposis are having less than 150 and more, 50 polyps and more. In another situation, if we have one first-degree relative with cancer or adenomatous polyp starting before the age of 60, or 2 or more first-degree relatives with polyp or colon cancer at any age, at this case, colonoscopy is going to be done every 5 years instead of 10. The age of starting the colonoscopy is going to be at the age of 40, or even 10 years earlier than the earliest case of polyps or cancer in the family, whichever comes first. In both first-degree relatives who is having cancer or adenomatous polyp before the age of 60 or after the age of 60, the screening is going to begin at the age of 40. But those who have one first-degree relatives with cancer or adenomatous polyp before the age of 60, then we can start the screening 10 years earlier of the age of the case. So the screening sometimes can start before the age of 40. In case of 2 or more second-degree relatives with polyps or colorectal cancer, also this is carrying average risk. So the screening is going again to start at the age of 40. So we are going to start the screening at the age of 40 in 3 situations. If the one first-degree relative with cancer or adenomatous polyps start at the age less than 60 or before 60 years old, or after 60 years old, or even if the screening is if the relatives are of second-degree relativeness, but 2 or more family members with polyps or colorectal cancer. In case of the patient is having 1 second-degree relative or third-degree relative affected with colon cancer, then there is average risk screening. So we are going to start the screening at the age of 50. Sometimes the interval or the next colonoscopy is going to be determined by the findings. For example, during colonoscopy we found that 1 or 2 tubular adenomas, which is small, less than 1 centimeter. In this case, the colonoscopy is going to be repeated after 5 years. But if we find more than 2 adenomas, this is going to make the colonoscopy in the coming 3 years. Also, in cases of incomplete examination, or if the number of polyps is more than 2 or multiple polyps, or even if the adenoma is advanced or malignant, or if we have large sessile adenomas which is carrying more risk of transformation, in these cases the colonoscopy is going to be after short interval based on the severity of the case and the clinical judgment. Thank you very much.